success rates in the fertility treatment. Essentially what that means is how likely one is going to be successful in having a baby after fertility treatment. Well, actually the answer to success rates is not very straightforward, and some of your questions are addressing that. So we don't know for sure how people perceive success, although I would expect that most people want to include the definition of having a baby in there, but the reality is that some people are not. They may be confused, they may read pregnancy and they think it means having a baby. So I think the definition of success rates, if anything, should be as clear and patient-friendly as possible. I think if I were a patient and I were looking at the website of a fertility clinic, actually it would have been very difficult for me to understand exactly what to look for. The reality is that there are a lot of numbers and a lot of statistics which come out of success rates, and I think it is important to maybe put some sort of simple rules out there for people so that they can understand how to read them. And essentially one of the important points I would like to make is that clinics should make an effort to deliver explanations about the success rates that they display. I think that would probably be a very, very good start. I mean, certainly success rates are going to be very clinic specific. Some clinics will maybe a little bit better in their performance than others, or they may be treating patients who are easier perhaps to achieve a good outcome rather than others. But on top of that, it's also the presentation of the success rates, which may be different between clinics. In the UK, there is a lot of effort. There is a recent initiative from the HFEA to standardize the best success rates to display and to gather, and not only the clinic websites, but also the HFEA website as well, to ensure that everybody is looking at the same. So at the moment, we don't really know what these best measures and statistics will be, but if anything, the collaborative effort between the regulator and the clinics matters to ensure that everybody gets the same message out there and we can standardize and reduce some of this variation. The limitations of success rates. I think one of the challenges of success rates is that they only tell you one part of the story. So they may tell you, for example, what the chances are if you have a transfer of an embryo, how likely it is to have a baby after that, through that. But what it doesn't necessarily tell you is how easily or how likely it is for you to get to the stage of transferring that embryo in the first place. So unfortunately, there isn't one magic statistic that will cover everything and be easily understood by everyone. So ideally, we probably want a combination of some of those statistics which are presented in a very simple manner so that people can understand what they mean and obviously relate it to their own circumstances. Interestingly, everyone will have their own unique chances. Can we give everyone their own unique chances with absolute certainty? Probably not, because our statistics are not that precise. In fact, the way statistics work is that you have to gather large numbers to be able to produce a statistic, and therefore you need to include people perhaps who are similar, but they would not necessarily be identical. And that is why clinics often use the age as the most important factor to stratify their success, simply because that's a very important factor for success in the first place. The science says the age of the woman matters most, but furthermore, it is very easy for a woman to relate to that age, to her age group, to get an idea of what would be her expected success. Will it be precisely her success rate? Probably not, because she may have PCOS, or she may have endometriosis, or she may have another condition. And even if she does have a condition, probably the same condition may be different to her than somebody else's who has the same condition. I think what matters there is whether they have specialist advice about that, because the specialists are in a very strong position. They have the expertise to understand their own circumstances and perhaps give them a good approximation of what would be their own success rates. But at the end of the day, I think what matters for most people is to understand roughly where they are and how likely or not likely things are to work for them. I don't think that people need to know the success rate with the precision of a single digit or a decimal. I think what they want to know roughly is it like 50% or 40% or 30%, 20%, etc. So I think as long as they get expert advice from somebody who has good understanding, I think that sort of feedback on what is expected of their journey should be good enough for them to be able to make informed choices and decisions about what they want to do. Absolutely, success rates can create false hope, but they can also create extra distress. So they could create false hope if you were to see that the success rate for your age group is really, really high. That puts pressure on you, or perhaps your expectations are very high that the first treatment may work. The reality is that even if the chances are very high, let's say 50% high, that means that there will be 50% of women who will not be successful in their first treatment. So I think it is important to take those numbers as part of their decision making, but not necessarily use them to understand whether it's going to work straight away or not. False hope, if let's say the expectations are high, sometimes there can be hope there, too much hope. Hope is not a bad thing, by the way, but I think it's important to be also realistic about it. On the other side, there can be extra distress if someone knows that the success rates are quite low, that perhaps that may make them stay away from fertility treatment, although at the end of the day, unless one tries, often they don't know if they're going to be the one. So I think there is always a risk of either feeling too much hope or too much upset reading success rates, and that is why also it is important not to use that as the only factor in making decisions about your future. And it is very important for clinics to try to present success rates on their website in an ethical manner. At the end of the day, we are healthcare professionals. We are here to help people. We need to give them truthful information. We have a duty of care to be transparent. Certainly there's a commercial element to setting up a website, and obviously part of the website for a fertility clinic is to display success rates. I think it is important that there is truth in everything that is written there, and I think it will help a lot if there is a unanimous approach by all the clinics, including the regulator, about how to best present those rates, so that there is one message and a simple way for everyone to read the same thing in every website. So I think we're working in that direction. We're not there yet, but certainly we want to move there, and we think that this will make things better for people to understand and really relate to these numbers as a useful tool for their decision making. I think at Bourn Hall there is a lot of work that we have put on our website, not to just present statistics that make sense to us, the healthcare professionals, but also to our patients. So if you look at our success rates page, you will find that there is information about how likely one is going to have a baby through an egg harvest, and I think that's an important milestone, because pretty much everybody who goes through an egg harvest, they are prepared to use all the embryos they make from it. We have also introduced another statistic, which is how likely one is going to get pregnant if they persevere with treatment at Bourn Hall after a year. And I think it is very important to our patients, not just having a baby, but also how long it takes to have a baby. So from our side, we are putting a lot of effort to try to also include statistics and success rates that are making sense to our patients, not just to us. So hopefully that will become even more in the future, and hopefully all the clinics will agree in doing that in the best way possible for our patients. Well, my message to anyone who looks at the statistics of IVF success and they feel discouraged is, first of all, is to keep their cool. Make sure they have a good discussion with one of the professionals, the fertility specialists. Our fertility specialists at Bourn Hall are very experienced and very transparent and honest, and they will give you what they expect you can get out of a fertility treatment like IVF in a very honest manner. I think it is important that you get that feedback before you can use that feedback to be able to understand where to go. It is important to appreciate that no statistic will tell you if you are going to be the one who is going to be successful or not. So there is a limit to what statistics can offer to you, and if anything it's a tool, but it shouldn't be the main decider of whether you aim to go for trying some fertility treatment, which at the end of the day may be what is indicated for you and your circumstances to help you have a baby.